I want to get some other supplies as well. So what else do I want for setting up the handpiece? Syringe cover. Good. How many typically?
One.
Could be one. It's going to be one or two depending on how soon it is before you polish your patient. And I'll explain that further. So I'm going to open the handpiece with my patient treatments and overs. And you probably noticed from opening a gauze packet already, it opens better not on the side that's taped over, but the opposite end. You're going to leave it on the counter like this to open it so that if you open it up here, there's a good chance it's going to fall out and then you need to get another one. So we don't want that to happen. So I'm just going to leave it on the counter. I'm going to pull it back. Just trying to be careful that it doesn't roll off onto the countertop or anything. So I'm just going to open that. I'm going to open the probe angle. There's a little place on the side for you to tear them. So I'm opening this. And I'm going to kind of just get the end of that out so I can pick it up after with my patient treatment gloves. So the overs are going to come off, and I'm going to handle the handpiece with my patient treatments. And I'm going to attach it to the left hose at the unit. So when you're looking at the unit, you're attaching it to the left. You have two hoses to the left one.
Is that opposite for you?
Yours will be up to the left one. Yours will be, if you're over here, it's the end hose. It's just the left hose still the left one when you look at it. It won't be the middle one for you. It'll be the left one.
So the last one on the right?
It's the left. There's two hoses. Pick up the one
in the middle
to the left.
No, I mean for a lefty, it's opposite.
It's still the left hose. When you look at that unit, pick up the one to the left. So on the handpiece, there's two tubes. So all you do is you match. It'll only fit in one way. You put the small one into the small hole, big one into the big hole, and then you just slide up the collar, and you'll tighten that all the way. It should go. This should thread all the way up to the top. So just stay with this one. All right, so that goes on. Hope I don't drop it on the floor. Good. That gets hooked there. Then I'm going to get my overs on. I'm going to cover that with one of the sleeves.
Could you put the head on before you put the handpiece in? While you're already in your patient treatment clothes? No, the propane.
No, but I'm going to show you. So this is going to go on over this. And then I'm going to take this with my patient treatments. You can handle this because we'll be handling it on the patient. And so there's a little piston in the handpiece. There's a hole in the top of the handpiece. And you're going to puncture, just kind of like what you do with the air water syringe, just break a little hole in the top. And then you're going to see there's what's called a locator button on the side of the handpiece, and there's a notch. Those two line up, and it just goes on with pressure. You have to push it all the way in. And that should be it. Then you would step on it to make sure it's going. And you want it to just spin around, so that's good. And really it's set up, and the only reason we have another sleeve here is, let's say you've set up early in the morning or early afternoon, and you're not going to get to polishing until several hours later. We just put this over so that it's covered and looks good for the patient that it's covered during the appointment, and then you would just pull it off when you're ready to use it. If, say, you're setting up and you know that you're polishing right away, there really isn't a need to have it covered. So it's just if it's there, it's just if it's out for an extended period of time. Keep it covered up for prevent aerosols and stuff settling on it. And that's it, that's the setup. So everything, all the rest of this stuff would just go in the trash, and you'd be ready to start your appointment.